And action. Scott had a question about disc disease. And discs are the portions of the backbone or the spinal column that give cushioning. This is a makeshift model of 4 vertebral bodies. These are probably lumbar vertebral bodies. So the spinal column is made up of these vertebral bodies. They go from the base of the neck and go all the way down to the tailbone. The tailbone and the sacrum are fused, so they're like 2 independent pieces, but the rest of the column is made up of these things. And there's discs between the vertebral bodies to give a little bit of mobility. So you're supposed to have mobility so we can bend and forward flex and hyperextend. And we can also be mobile, and we also tolerate a lot of strength, or at least weight. So it's ingenious the way this thing was developed, but it's the axis for the rest of the skeletal system. And the problem is, with these discs that are supposed to give a little bit of cushioning and mobility, you also have the spinal cord. The spinal cord goes straight down from the brain down to the tailbone, and at each level, wherever there's a disc, there's also a root that comes out. And the roots that come out are supposed to go from the cord all the way around to the front, take care of sensation and reflexes and strength. So this is a picture of somebody's back, and you can see the cord starts up at the brain, goes down, and then gives off its roots. And the roots collectively go down and take care of different parts of the extremities, down to the fingers and toes. That's a big plexus, it's called, up here, and a big plexus down here. So the problem, what we'll see with a pinched nerve, say, is that when you have this disc here, and you have this delicate root here, if the disc, which is supposed to bulge, it's supposed to bulge every once in a while to give you mobility. It also offsets the pressure depending on where you are or what position you're in. When there's a fight between the disc and the nerve root, like here, the nerve root's always going to lose because there's a small space here, and it's just enough to get the nerve root through. And if the disc decides to bulge out, it's going to, the pressure of the disc, especially with supporting the upper torso and abdominal area, will always push and pinch whatever is in its way. This is a top view of the disc, and then there's the jelly on the inside. It's supposed to be very tough fibrous tissue on the outside, like a tire. Then you know, if you've ever seen a tire in slow motion hit a pothole, the tire will bow out and then come back in if it's good rubber. The problem with a disc is if you can overcome the force of this fibrous tissue if enough pressure is put from top to bottom, like jumping from a 2-story window and trying to land straight up and down. That's a lot of pressure, and if you kind of go like the military guys, the Rangers do, and diffuse the pressure coming down, the force coming down, then you'll be able to tolerate it. But if you're straight up and down, then this disc is going to push out to one side. If it pushes out to one side, it's called a bulge. When you have a bulge, the pinched nerve, that one root at that area, or that outlet, the pinched nerve, will give a classic symptom. And usually it's pain in the area of the low back, and then it'll be eventually numbness and tingling to a certain part of the foot or a certain part of the leg, and then it'll lead to decreased reflexes, and then eventually motor strength stops, almost like a foot drop or a limp. So that's the process of a disc. And here's the thing. When we have symptoms like that, most doctors can tell, because of the well-known distribution of these things, most doctors can tell by symptoms and by evaluation where the level is. We can usually figure out, okay, it's probably L1, L2, L3, L4, S1. Those are L's refer to lumbar spine, S refers to sacral spine. So we can tell just by mapping it out on symptoms. Sometimes what we'll need is an MRI to better define where exactly the bulge is. Or, worst cases, if the bulge occurs, sometimes this tough fibrous tissue will leave a little piece, like this black piece here. And if the black piece is left, like a shard, that can act like a knife in the nerve, and it will cause non-stop pain, even if the disc bulge comes back in. And they do come back in. They're meant to, when the force is enough axially, top to bottom, it'll push this way on all of them. And you'll have a little bit of a bulge out like that scenario with the tire hitting a pothole, but it'll come back in. if you have a healthy body, if your tissue is healthy, if there's not that much pressure, if the body's muscle system is intact. So when you have the back, you have back muscles. The abdominal area, or the core, is supposed to be strong. If the core is strong, then the back doesn't have to do that much work. If the core is weak, or if you have a big belly, or if you have a hernia, like a ventral hernia, then you have to have more work on the back. When the back has to do more work, it has to freeze up, and it constantly fires off, and it stays cramped. Imagine if the muscles on each side of this column have to constantly stay contracted. You're pushing down like this, you're going to cause that disc to come out. Usually it takes a fall or excessive overuse, like putting tiles in a project on a floor. When you're not used to it, if you have to hammer and be bent over constantly, that's a lot of pressure in one direction. Eventually it's going to rupture out. Or when you have to shovel snow, you're not used to it. Even if you exercise all day, every day, 365 days a week, one day of shoveling snow in this position all day long will cause an overuse injury, and that's the disc thing. So when you have an MRI that shows a disc, it gives the surgeon a clear-cut path to say, okay, fix this, and the symptoms go away. Here's the problem. MRIs, if you do 10 MRIs on 10 individuals coming up the street, 7 of them will show a bulging disc in people without any symptoms. So the theory is that, again, because discs are supposed to bulge, if you get an MRI and you have a person with symptoms, are we going to cut everybody? And that answer is obviously no. So you have to be careful. What we have to do before jumping straight to an MRI, because I know a lot of patients want to ask for MRI straight away, which is like a $2,000 to $4,000 test. The better thing to do is take it easy with activity, and then start the rehab process with a physical therapist. Get on an anti-inflammatory diet, which you should be doing already, and then perhaps take anti-inflammatories, prescription-wise, muscle relaxants, maybe pain control so that you can get some sleep. So this is where we use Western medicine and non-traditional medicine. I always say that we want to take the time frame of pain and suffering and compress it as best as possible. Sometimes, even if you exercise on your own, a physical therapist can always eyeball and make sure that we're doing things properly, if the core is right, because there's certain exercises that are a no-no. There's concepts of Williams and concepts of McKenzie. There's 2 different exercises. One involves forward flexion, the other involves extension. And if you're used to exercise in a gym, it's totally different. So you have to have physical therapy look at you, evaluate you, give you a designed program, get you to heal up fast. Also have to not do any further harm. So if you're a construction worker, or if you have to sit on a chair for a long amount of time, that's harm. Definitely if you have to keep on shoveling snow, that's harm too, but your body will tell you no more. It'll cause pain, it might cause numbness, it might cause you to have foot drop or fall down. That's an obvious sign. The other things that we have to take into consideration are the health of the individual. If you have somebody that's 90 years of age, there's no way you're going to operate on that person. So you have to do conservative. If you have somebody that really is crucial to do a significant amount of work, and they can't stop, all right. Sometimes back bracing will be helpful, but usually pain will continue even with bracing. So it's always important to get an evaluation. It's important to get into physical therapy and rehab. It's also important to cool down muscle response. So if you have a spasmed muscle along the sides, you want that to calm down. Sometimes physical therapy and or massage therapy or myofascial release will be great. I've also used anti-inflammatories like turmeric, anti-spasmodic medicines or herbs like valerian. There's topicals that can be used, whether you use helichrysum essential oils, topical anti-inflammatories from a compounding pharmacist, or topical steroids. The beauty of also getting into physical therapy is that they can use modalities like ultrasound, electric stimulation, to send medicine through the skin into that area. So this pinch will go away fast, or at least the steroids that you get into the skin, through the muscle, will help the nerve stay protected. Inflammation hurts nerves. Anti-inflammation heals nerves. Sometimes we'll do an injection into the backbone via fluoroscopy and dump steroids to this local area to, again, protect the nerve while we wait for the disc to pull back in. Inversion tables are when you take the weight of the torso and try to pull apart. They do help intermittently throughout the day, But again, the trunk muscles have to be good, the health of the individual has to be good, and the diet too is also important. If you can't get any sleep because you have pain, that's the reason for the painkiller. But if it's not just to knock down the brain pain or the concept of pain in the brain, but it's also to get a good night of stillness. When you're tossing and turning, you're asking the back to move a lot, and it will obviously wake you up if you're tossing and turning and you're in pain. So the rehab process of inflammation fixes itself overnight. If you're not getting any sleep, you're not fixing itself. You're not fixing that problem. You're just adding to the disease, and the muscles have been tired, so when they get up the next day, they spasm immediately. So thus the reason for antispasmodics, which cause drowsiness, yes. Painkillers, which cause addiction and definitely drowsiness. But this is the beauty of compressing the time frame of healing. You can use herbals, but I would use herbals and I would use medicinals. I would also use a hands-on healing approach, whether it's massage, myofascial release, physical therapy. It always compresses the time frame of healing. It speeds up the healing time and the resolution. So hopefully, Scott, this will get better. If we can't go any further, then we also have to consider having surgery again to take this little piece off and give more space to the nerve. One caveat, though, is that if you do have disc disease in this area, sometimes the disc might not be the problem. And it might be a pinch in the piriformis, it might be a pinch down in the hamstring, it might be a pinch somewhere along the line of the compartments of the foreleg. So it'll almost appear and fake the symptoms of a pinched nerve in the back. So we'll be doing surgery, major surgery on the back, when actually it's a pinch somewhere else. That's called a double crush. So it's important to get that thing called the EMG, where they take a nerve test and go down the line to see where it's pinched off. One nerve test might not be enough. You might have to have, I know the guys at RIC, Rehab Institute of Chicago, they do nerve tests where they're very fine. They go right down the line versus the big start at the top, get at the bottom kind of nerve test. So depends on who you go to as far as interpretation of data. So this will turn around, but we have to stay protected, cannot do any further harm. We have to progress into the next treatment plan while staying good with our diet, our sleep, and doing no further harm.